next one is a hip mobility using a box. So we're going to bring your foot up onto the box. Box height should be roughly about hip height, maybe a little bit less. We bend the leg at about 90. Set the opposite foot, get a little bit of balance. From here, we're going to bend from the hips. Try and bring your chest towards the box. Depending on your flexibility will determine how low you can get down. The closer you can bring your chest towards the box, the better. And I'll just show you from the front view as well. Again, set your knee up. Hinging from the hips. And as we bring the chest towards the box, you should feel a little pinch. And okay, so the first for the so here we have a 90-90 hip mobility drill. So front leg is at 90 degree bend at the knee. The opposite knee is out at 90 degree from that hip. From here we sit up nice and tall. We're folding from the hips. We try to bring the chest towards the ground. All that movement, trying to hinge from the hips. Try not to lose it through your spine. Feel the pinch and then coming back out of it. Okay, our second movement is with the foot that's out to the side. From here, we're going to just try to take that knee away from the floor. Just trying to sit up nice and tall. And I'll show you those two movements just from the side view. So I have front leg bent at around 90 degrees, straight in front of the hip. Knee at 90. The opposite one is bent at 90 out to the side. I'm sitting up nice and tall. I'm hinging from the hips. Bring that chest towards the ground. And the second movement, we're taking that, you can see my right knee going away from the floor through whatever flexibility it's allowing you to go to. Okay, so next hip drill, we're going to go into a box position, and then from there, we're going to bring our knees slightly behind the hips. We'll bring the foot to the outside of our hand, okay, and then what we're looking to do is bring the chest to the floor, okay, so we can do like a baby push-up. What we're looking with our foot, keep our foot nice and flat, and driving the knee out to the side. So jam your big toe down, push that knee out, and try to work in through your hips. Depending on what your flexibility, you may be able to get down onto your elbows, or you may be just able to get here, hang out here, and do them for our prescribed reps. So what it looks like from a front view, we're here, set the knee slightly behind, our foot's to the outside. On this side, we're jamming our big toe down. We're trying to push that knee out to the side, and then from there, either bending from the elbows, or we're seeing can we maybe get down into this position and back up, depending on what your flexibility levels are. Push the position, bringing the foot to the outside, whatever hand is close to that foot. We're going to take that hand and sweep it open, nice control, trying to rotate as far as we can. With the leg that's out behind, what we're trying to do, we're trying to extend through the hip and knee. Okay, so we're not bending that knee, trying to keep that nice and locked. And then from there, sweeping through, nice controlled rotations. So from the front, setting that good push-up position, good alignment. Then from there, setting your foot out to the outside of your hand, keeping this foot flat on the floor, driving your knee out, and we're left leg is out. Okay, so first movement, I'm going to reach up with my right hand. I'm going to stretch, push forward, try to get a nice stretch into that right hip. Then from there, bringing my hand down, straighten the leg up, get a nice stretch, and then I'm reversing that movement, stretching that hamstring, reaching up, squeezing the glute, going from your hamstring stretch out into that hip flexion stretch. So from the front, whatever knee is on the ground, it's that hand that reaches up for your hip flexor. So my right knee is down, right hand is up. Should be squeezing left glute and really trying to feel that into your hip flexor. Then from there, releasing your hand, trying to straighten out the opposite leg and going for your prescribed repetition.